Honorable Justice Devan Ramachandran Sir, Judge, High Court of Kerala, is the chief guest of the event. Honorable Justice has started practice as advocate in 1991 after completing his legal education from Government Law College, Ernakulam. Honorable Justice has assumed office as Judge, High Court of Kerala in 2016 and has delivered several landmark judgments that has impacted public life and society as a whole, one of which is your lordship's judgment in regulating COVID treatment charges in private hospitals. On behalf of IPA Kerala State Branch and Amrita School of Pharmacy, it is my privilege to invite the chief guest of the day, Honorable Justice Devan Ramachandran Sir, to deliver the inaugural address.
Good morning. That makes me feel like I'm standing in a class now. This is the first time I'm in the midst of so many pharmacists. I've never seen so many of you together. Mr. George, I must thank you, not for the encomium you gave me, because it is not true to me, but for the words you spoke, because it dispelled many of my doubts and answered many of my questions. I'm sure you'll relate to me if you treat yourself as a layman, that the first contact you would have ever had with a pharmacist was in a medical shop. I was very young when I went to the medical shop for the first time. The pharmacist was my hero because I gave to him a prescription which were just lines, impossible to read. He read it, deciphered it, and gave me something. I was completely taken aback. I had no idea how he read it. It was just 3 lines. So this was our first encounter with a pharmacist. And really, I had never thought of the importance of a pharmacist until the organizers came to my chambers and invited me. Frankly, I was not even aware that there was a pharmacist day. That's why I said, Mr. George, you have answered many of my questions. What really is a pharmacist was something that kept on bugging my mind for the last couple of days. I did try the internet. I asked my staff to give me some information on what pharmacist means. We got all the formal information that is normally available online. But what really is the importance of a pharmacist? If a pharmacist is only to take a drug out of a medical shop shelf and give it to you, really, does it require so much of expertise? You're all going through education which will take you for 5 years or 4 years or whatever. So it was really baffling to me. I was thinking, and Mr. George is right. A pharmacist is the most underrated and unseen face in India today. But then things are changing, no doubt about it. He's right again. Internationally, no physician would dare prescribe a drug without a pharmacist next to him. And I'm sure that that kind of a culture is now coming into our hospitals also. As he rightly said, doctors do not know the medicines. They do not know the formulations. You're all studying this, so I don't intend to sound more knowledgeable than you are. But then, pharmacology, as you are aware, has 2 broad, very important elements. That is the pharmacokinetics and the pharmacodynamics. These are not things which a doctor studies. The doctor doesn't know how the drug is absorbed, how it is taken through your system and then expelled. That is the pharmacokinetics system. He is also not possibly aware how the dynamics of the drug applies to a patient. So these are the importance of a physicist. Don't take yourself lightly. You're very, very important to our healthcare system now. Things are changing. If we have not recognized you yet, the day is not very far when India will recognize you as a foremost partner of healthcare. And it is extremely important because with so many drugs coming in, so many names that have been brought in, confusing, absolutely confusing. If you want a paracetamol, I would possibly think there are 500 combinations of it on the shelf. We have no idea how it affects each individual body. Please understand that there is an enigma in all the sciences that we learn. We know that 1 + 1 is always 2, but sometimes you have no idea how it applies on a body, on a human body. The same drug that you apply to a patient who is in an identical situation with another may not cure him, but will cure the other. This is the element of God. This is the element of that power, the supreme power. And you work that power because you should be able to assess the needs of every individual human body. This is not a small thing. It's not a joke either. When I say that I am suffering from the same disease as the man sitting next to me, and if you give me the same medicine as you give it to him, you'll possibly be astounded to see that I may not survive, he will. This is because every drug applies to a human body in a different manner, because every human body is distinct and individualistic from the other. This is where the importance of a pharmacist comes into play. This is why I'm astounded that our health system does not even recognize it to the extent to which it ought to have been. Now, somebody talked about our intervention during the COVID-19 pandemic. We were really concerned about the costs, the escalating costs. It was so prohibitive that a man would rather die of COVID than go to a hospital and get treated. One of the main reasons that we saw was that the prescription of drugs by name. This is one of the most important things that I wanted to speak on, which I never had a platform earlier. And I'm so glad that I'm getting it today. You know, the Medical Council of India, as it was then, which is now called the National Medical Commission, NMC, they amended their regulations, if I'm not mistaken, in 2015 or 2016. I may be wrong on the dates or the years. They said that doctors must, as far as possible, prescribe drugs only generically. That regulation still remains. And this is an extremely salutary kind of a prescription, because then the role comes to you. When a doctor says this is the compound, this is the element that I want this patient to be administered with, it is then for the pharmacist to decide. And this is extremely important and extremely salutary, because the costs will come down. And this is not something which the pharma business would like me to say here. I'm not sure if they have their representatives here. I'm sorry to them. But I have no doubt that when we enter into a generic medicine regime fully, one, the costs of the treatment will come down, and second, pharmacists would become center stage. So it is your duty now to understand the formulations. And when you study a pharmacist course, it is now for you to study the combinations, to find out how each drug would react on an individual body. It is not sufficient for you to think that this drug will do this to a human being taken generally. You may have to deal with every individual human system and then decide, when a prescription comes to you, whether you should be really dispensing this drug or the other. Of course, the only exception would be when a doctor says that I do not want you to do that. I want this particular drug to be given. Your ethical standards will clearly tell you that when a doctor says you prescribe only crocin, you give only crocin, not paracetamol. But otherwise, when there is an alternative that is available to you, and you believe and you understand that the patient perhaps would be better served by another combination, or by the combination of the same species, it would be up to you to use your expertise. Just imagine how important your job is going to be. This is not something that you take lightly now. Jocularly, people say pharmacist, somebody who stands behind the medical shop. And what does he do? The doctors prescribe the name, not the generic composition. And you just simply take it out of the shelf. If I'm intelligent enough to understand how I stack the medicines, I can do it. But as Mr. George was saying, it is an offense. You know that every medical shop should have a pharmacist. The reason is this, because a pharmacist is not merely a tenderer of medicine. You are a person who dispenses medicine. If you are only a tenderer of a particular medicine, you don't require to be there. Don't Don't take yourself lightly. Don't demean yourself by thinking that your final job would be to stand in a medical shop and dispense medicines. That is only one among it. I was glad when I walked in, I heard a couple of young, bright students telling me that they're doing Pharm D. They would be doctors. They would be community doctors. And you are much more important than the doctors in the real world today because of various factors. Because, again, as was said earlier, there are more number of medical shops, certainly, than hospitals or doctors. And if every pharmacist in a medical shop is equipped to understand a person's problem and to dispense medicine, imagine there would be no healthcare crisis at all. Again, as rightly said, during the COVID time, everything was shut down but medical shops. Doctors were all inside. Nurses were unable to come out. But there were pharmacists on the road if possible. Why did we not see this? I don't think anybody saw this. We were still running behind doctors. We were still running behind hospitals. We did not equip our pharmacists to understand what COVID-19 was. If we had done that, perhaps because it was an oversight, but if we had done that, there would not have been a medical emergency or the crisis that we saw during that time, particularly in places like Delhi and all that. Kochi was far better. We were able to control it better, or rather Kerala as a whole. But if you see the crisis that we saw in parts of Delhi and Uttar Pradesh and all that, you would have understood if pharmacists were equipped to be next to doctors, things would have been extremely different. Please take this message along. You are the flag bearers of this message. Please don't let people think that you are a pharmacist and therefore you are a mere tenderer of medicines. You are not. You have a greater role to play. And I want this occasion and this August gathering to understand it and to take that message forward. Let us not make this meeting that we see today a mere formality. Carry the message. There is a message to it. This is something which I was not aware until I was actually called. Imagine if I am not aware, where we get so much of information. Even when we are hearing the matters, we got this information. We did not get this information. If we were told that a pharmacist is equipped to tender medicine, to dispense medicine, of course, we had to have the confidence also that you are equipped for that. So now a generation of pharmacists have to grow. You are the new generation of pharmacists. Don't merely think that your responsibilities are limited to merely looking at a prescription and then giving it. Especially in the regime of generic medicine, which is going to be the next big thing. I understand that in America, about 80-85% of prescriptions are generic now. This stalls a lot of deleterious consequences that you see in the healthcare sector. And therefore, your importance is now much more than ever before. I'm looking at the next generation of healthcare professionals. I'm looking at doctors and community professionals. You are the people who are now invested with the responsibility and power to do inoculations, vaccinations, and etc. Again, we missed this at the time of the COVID-19 because this was a completely new scenario that we had not encountered until then. But today we know what we are. Of course, there are other viruses and things like that lurking in the corners, and we have to get ready for that. You have a role to play. My dear children, you have a big, big role to play. This is not something that was told to you or taught to you earlier before, perhaps. But yes, you have a great role to play. And I will take this message through. And the next opportunity I get on the bench, this will be something that I'll speak upon. It will possibly get more attention when we speak on the bench than in any other platform. We will do that. This is an extremely sacred kind of a place, and I'm glad that you are all studying in such an environment. Just to take what Mr. George was saying, none of us live for ourselves. You may not understand it now. You are all young too. I've also gone through your stage. This was a stage where I thought I was important. And then when you go along, you understand how ephemeral life is, that you may not wake up tomorrow morning. You understand that you are not here to live for yourselves. You are here to live for others. That is why we are in this field. My field and your field are no different, really speaking, because it becomes sacrosanct only if you live for another, when you work for another. If I use my office only for my benefit, which I can easily do, believe me, I can, I would not have been called for this meeting today. I know that. It is your commitment to your fellow being. As John Donne earlier said, no man is an island. You cannot live in isolation. It is you find meaning in your life when you work for another. When you dispense a medicine and somebody comes out of it, you get that thrill. It is that kind of a high no drug can give you. This drug is not the drug that you dispense, but the drug that is done silently. We see the enormous influence of the other drug in the new generation now. It is because they don't understand that that high that they get is nothing compared to the high that I get today. When one of my judgments affect even 1% positively, that's the kind of high I get. And this is exactly the same thing with medical care professionals. You are not any different from a doctor. You are as important and as poignant as a doctor. Keep that in mind. And when you work for the society, and I'm sure you will, you are our investment for the future. And you are our fixed deposits, actually. I'm sure you will do very well. And I am sure when you perform your functions as a physicist very carefully and diligently, the costs of treatment will come down drastically. And I want Amrita Hospital, at least, now that I'm in the precincts of the hospital, to ensure that every prescription is guided by a physicist, a pharmacist, sorry. And I close by telling you that very interestingly, I saw something on the internet. You know, the most important inventions of pharmacists have been Coca-Cola, Pepsi and all that, imagine. So people know pharmacists by Coca-Cola and Pepsi. But then your role is not merely to make commercial concoctions. Your role is much more. You should be guiding the pharmaceutical sector. You will all become, if you want, in the garment sector, you will become controller of drugs and things like that. They're all very important positions that you can hold. But then even otherwise in private practice, as Mr. George was saying, we do not have pharmacists in practice. We will certainly make sure that you come in practice. You will come back in practice, particularly the doctors who now pass out. They are certainly in community practice. You can always assess the practice. Talk to your doctors. Talk to the doctors here. The principal is here. I'm sure he is hearing my words very well. He can always make a difference when in the medical field also. Because as Mr. George was again saying, I'm not aware of this, that your MBBS or MD does not take in pharmacology. I'm not aware of it. This is a new information that he has given me. If that be so, imagine doctors are prescribing medicines based on the information they get, either from the representatives or from the books. But you are not. You are the people on the ground. You are the persons in real time who can now guide the doctors in making a prescription. This is very important because because we understand that the contraindications of a drug is much more than the effects it has positively on you. And therefore, that is where you step in and aid a doctor. And I'm sure Amrita will show the way forward. I'm not sure if they do it already. This is not the first time I'm coming here. My father was admitted here years ago. I've been here many, many times. And I know the kind of commitment the doctors here have. I'm sure they will keep you in mind. I'm sure they will understand that you are an indispensable system, a part of the system, and that your importance can never be written down. Thank you so much, and bless you for being exemplary citizens already, and hope to see you as pharmacists par excellence. Thank you so very much.
Thank you, Your Lordship, for enlightening and vibrant inaugural address.